Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN, Healthy World, Healthy Nation, Healthy You. I'm Nancy Valentine, PhD and registered nurse, and this show is dedicated to you, the healthcare consumer. And today we're going to be talking about vision health with baby boomers, because research has shown that baby boomers do not take care of their eyes, and this is something that we are going to address. So the title of our show today is Preventing and Managing Vision Loss, What Boomers Need to Know. And we have a remarkable expert with us today, Dr. Nancy Sharts-Hopko from Villanova University. And I'm going to introduce Nancy in a moment because her knowledge of vision preservation and how to prevent problems is really important. So you're going to learn a lot from her and the work that she has done in this field. She directs and teaches the PhD program in the College of Nursing at Villanova University. Her specialty has been for many years in women's health, and her research has addressed problems such as health and life transitions, including menopause, hysterectomy, childbearing in foreign countries such as Japan and Bangladesh, where she both lived and worked, a diagnosis of HIV, disparities, and specifically, and most recently, vision loss. So the 3 things that we're going to cover in this show today include eye health assessment, which is really very important. A lot of people, as she will tell you, do not really even get the assessment to know if they have a problem or not. The second point that we're going to be covering is lifestyle changes and what you can do as part of your lifestyle to really contribute to your eye health. And then the third point that we're going to be talking about are people seeking health care and healthcare providers, what both providers need to know and what you need to know as a consumer so that you are asking the right questions and following through on your treatment recommendations. So Nancy, thank you so much for being with us. I think it's going to just be a very interesting walkthrough because as boomers are aging, they're often thinking of other things like my weight or am I going to, change jobs, or am I going to retire? So, I mean, it seems to me that vision loss may be sort of at the bottom of a lot of people's lists. But maybe you could tell us about how, with all of your research, you even got interested in vision loss.
I'm happy to, and commensurate with being a boomer, it starts with me. So my family has a lot of glaucoma. I have glaucoma. I have since I was 37. So I'm attuned to that issue. But through our work in the College of Nursing at Villanova with the Women with Disabilities Project, spearheaded by Suzanne Smeltzer for the last 12 or so years, I became aware that a disability of great interest to me is low vision or no vision. And it was much to my surprise to discover how untouched this is, particularly among nurses.
Yes, well, you were telling me earlier, Nancy is probably the only nursing professor in the country that has really taken on this vision loss from a research perspective and is really making a major contribution as a nursing professional to this field. So I really think you should be congratulated on that. I mean, it's one of those things where your own life experience has really helped to influence your career and consequently is helping many people, including those of you who are listening to this show today.
Right. I want to touch on how big this problem is because it's unbelievable. The Centers for Disease Control and Prevention estimate that about 21.2 million Americans currently experience low vision or no vision. And we anticipate, as the boomers age, that up to 500,000 per year new people will be added to that number. So it's a significant problem, and it's one that the health system in general has not addressed or accommodated to. One of the things we know is that the boomer generation, and so interestingly, perhaps you've read in a recent National Geographic that we should all be thinking of living to 120.
Oh, that'll be interesting.
Yes, that's another show. So given that we have a longer lifespan, we're seeing it now and we're anticipating soon that becomes a normative experience. We know that when even one eye has vision loss, which is defined as 20/40 with correction. Vision loss is 20/40 or worse with correction. When one eye is affected, your life expectancy is shortened. Quality of life diminishes. So we know that vision loss is one of our top 10 disabilities already.
Right, and I think it's really wonderful that we're having this discussion because really we don't hear those kind of statistics and we really don't think about the impact that that's having on any community.
Mm-hmm. Right. I can share an example that we actually discussed previously. One of our colleagues gave birth to a child with no eyes, and it was much to her surprise that in this well-resourced city that we live in, our premier children's hospital was absolutely unprepared to deal with a no-vision patient.
Right.
Most of our healthcare facilities, we have discovered, are ill-suited to manage people with low vision or no vision. So all the more reason why we want to prevent that.
Right. Well, I think we'll get into some of those details later because that has implications for you as consumers with low vision or no vision when you are in a healthcare facility, what you need to be aware of. And again, hopefully we will be able to influence facilities to really address this problem and really take care of that with you and for you. So I think the quality of life is one that most people can relate to because I happen to know a few people who are really much older. They're in their 80s, and one woman in particular who was a very influential mentor for me, a woman who reads constantly, very aware, and when she started having vision problems, her quality of life has really plummeted. So tell us about how that works in terms
some of the issues for people with vision loss. One thing that happens is, well, of course, one of the obvious things that happens is people cease driving. And so with, we are a very car-oriented culture, particularly out here in the suburbs. So with loss of driving comes isolation, loss of social connections. People lose the ability to read unless they can afford the technology to enable their computers to read documents to them or to purchase reading machines, which start in the 5,000 and up range. But most people find those things hard to reach. We know because of the isolation that we see higher incidences of depression in people with low vision or no vision.
Right.
We see that people slack off on their general health care. It's too much work to get to your health care provider. They are not necessarily attuned to meeting the needs of people who can't see. Somebody might point and say, go over there, and the person can't see where there is.
Right.
Staff may not understand that they need to help people do paperwork. This all takes time in our very busy system. So these are just a few of the issues that people experience.
Right. Well, given that so many people have this problem to begin with, do they even know that they have this problem? How do they really assess this? I mean, what are your recommendations for just assessment for the average person?
That's great to talk about. I defined for us low vision, 20/40 in the best corrected eye. No vision, legal blindness, is considered to be 2200 in the best corrected eye, if there is such a thing. And that doesn't even take into consideration some of the changes that we experience, some of which are simply age-related. Your muscles relax, it takes longer to focus. People experience dimming, they experience floaters, they may experience cloudiness or glare issues. And that's all aside from your visual acuity. So people need to have annual eye exams as part of their overall health exam. They need to at least look at an eye chart. They starting in midlife, need to have periodic, every year or two, simple pressure tests that their primary provider can do. boomers need to be attentive to having regular eye exams. We find that even if they have known eye problems, prescription lenses, only something like 21% of boomers have annual eye exams. Even with family histories of eye disease, they don't think that that's going to happen to them. So screening is
really
a priority.
I don't think that most people think of that, quite frankly. I think unless they are having an eye issue, they would not necessarily think that this is part like your annual dental checkup, that you would be looking at your eyes that frequently unless you had a problem. But some of the things that you've already mentioned, like floaters, cloudiness, if you have that, you should immediately have an eye assessment.
Sure.
But
if anything is interfering with your vision, you need to have somebody with specialization in that area start taking a look.
So the idea in back of having an annual eye exam is that some of these things can be very subtle, so you wouldn't even necessarily notice them. That's why it's really important to have a professional assessing your eyes so that they can tell you, and then they have a baseline over time so that they can really see changes, and those changes can be corrected on a proactive basis rather than on a reactive basis.
Our 4 top diseases of the eye that occur as people age include cataracts, glaucoma, macular degeneration, and diabetic retinopathy. And interestingly, they all have in common that they are diseases of microcirculation.
Can you describe what that is? A lot of people won't know what that means.
So your eyes are small, and the vessels that perfuse them are tiny vessels.
So you mean the vessels where the blood goes through, because perfuse is not a word that the average consumer is going to know.
Right. Your eyes need oxygen and food, just as every other part of your body. Every tissue of your body needs oxygen and food, and your eyes need that too. In fact, they need a lot of it. And they are a fluid environment, so we need to keep them nice and moist, you know, lots of moisture and so on. So the diseases that I mentioned, the 4 diseases, because this is a tiny circulatory system, a tiny circulatory disease in all 4 cases, although they vary, think about the things you know for heart health as things that are good for your eyes, and things we know for the prevention of diabetes, which is related to heart and circulation. Those things are good for your eyes. So they include, don't smoke.
Right. That's good for everything.
Yeah, that's good for everything. It's really important for your eyes. And we know that only 1% of boomers in a survey that Lighthouse, which is a vision advocacy organization, did, only 1% of people recognized that smoking cessation was something they needed to do for their eyes. We know that eating bright vegetables, varied bright vegetables and bright berries are good for your eyes, just as they are good for your heart. Eggs have lutein. Lutein's great for your eyes. Back to more important, sunglasses are really important, and we have a picture to show of sunglasses that provide good coverage. Think of the sunglasses that skiers might wear. They provide good coverage at the side and a large area over the eye. So you want good sunglasses with coverage and good UV filtration, UV light filtration, ultraviolet light.
They're very good, but they're not special necessarily. They're just glasses that are designed like the picture you're showing us.
Yes, the kind of glass, these are not prescription glasses, but sports enthusiasts are inclined to wear these glasses with very good coverage.
Right, and they're good looking too.
Very stylish, yes, very stylish. We want people to pay attention to their BMI. I know that that's the bad news. Everybody wants us to pay attention to our BMI, but our height and weight, we calculate the area, a ratio of area by height that we call the body mass index. And we want to keep our body mass index under 25 for most people as a measure of ideal weight.
Right, so that's a question that you can ask your primary care provider when you go for your primary care visit. not just how much do I weigh, of course that's like the first thing you want to know, but what is my body mass index, what Nancy just said, the BMI. That way there's another chart for that you can use as a baseline to see if your BMI is within normal range. You may not feel like you're particularly heavy, but sometimes those BMIs can be higher than you think they might be. And that could be a wake-up call to having to lose those 10 or 15 pounds that you've been carrying around, because the BMI is a more accurate measure of your weight as it is in proportion to your size. That's why it's important, not just your weight, but in proportion to your size, you know, your carriage, etc. So I think the other point that you just mentioned that I want to go back to is the whole idea of stop smoking is so important. But if you are smoking and you happen to be younger, but you're living with boomers, you've got that secondhand smoke.
Yes,
so I mean,
absolutely.
it may not be the person themselves as a boomer that's smoking, but they could really have bad effect of people in their environments.
Yes, and the one of the destructive features of nicotine is it's a constrictor of your blood vessels. So all of your systems, including your eyes, will respond to that toxin. That's why that's an important issue. Exercise is known to reduce risk of glaucoma and cataract. Of course, if diabetic retinopathy goes with diabetes, we know that exercise is an important feature in diabetes management. So there's nothing new and amazing about this. It's just that we tend not to think about our eyes.
Right. In terms of diet, how about coffee and alcohol?
The research does not suggest that caffeine is a problem.
Okay.
And the research is mixed on alcohol. It seems like a little alcohol, probably that same 1 glass of red wine that's good for your heart, seems to be beneficial to your eyes. But more than that can be associated with some of these eye diseases.
Okay. So anyway, that list of things that you really should pay attention to will be good for your health overall. But it's also nice to know that when you're focusing in, say you're a diabetic or if you have heart problems, that your eyes are going to benefit for at the same time. I think it's really important to really have that holistic view of one's health and to know that anything you're doing is going to be positive for many parts of your body.
And I think to get back to the earlier point that we addressed about screening, you want to know early on if any of these diseases are occurring. Glaucoma is probably the sneakiest. They call it the silent sneak thief of the night,
okay.
Because your vision very gradually erodes from the periphery in. And you won't notice until the loss is significant. Macular degeneration goes the other way. It starts from the middle out. Peripheral vision is the last vision that's lost in macular degeneration. So that is more noticeable than the loss of peripheral vision. I think cataracts are a little sneaky. People will notice that they're particularly bothered by glare in the sun or when they're perhaps driving their car at night. And diabetic retinopathy, if somebody is under care for diabetes, that is something that's monitored quite well.
Let's talk about cataracts for just a moment. Aren't most boomers going to have to deal with cataracts sooner or later?
Yes, probably they will. It is an oxidative process, the thickening of the lens. It is manageable when your lenses get ripe, sufficiently thick and cloudy. You can have them, the diseased lenses removed, and they can put in lovely, clear, new prescription lenses that will be very helpful and people say are wonderful. I have to say, though, all invasive procedures carry risk, and so, you know, if we can avoid it or stave it off, it's all to the good. Most people do just fine with cataract surgery, but once in a while people have infectious problems or other kinds of problems. So there are no free rides in surgery.
Right.
So that's where sunglasses, it's with cataracts, the sunglasses are the most important, play the most important role.
So if you wore those sunglasses, especially the wraparound view that you gave us earlier, you could maybe postpone your cataract surgery significantly, especially if you wore sunglasses from a young age on.
Yes, Oh yes, and we are poor as a country in disciplining our children to wear their sunglasses when they're young.
Right. You said there was an oxidative process to get cataracts. Can you describe what an oxidative process is?
So oxidation is a process of deterioration of anything due to exposure to depleting processes or depleting substances. So rust is an example of an oxidative process. Many of our body tissues respond to sunlight and air interacting with them over time. So cataracts are one of those. When you talk about foods and nutrients that are antioxidants, like vitamin E, fish oil, those are products that slow that aging process, slow that wear and tear on the cell. So
are there vitamins, supplements that you would recommend that would help to slow that oxidative process down?
Yes, in general. Let me say that natural foods are always better purveyors of vitamins than supplements, but it's hard to get all that we need in food without taking in, thousands of calories. So we know that our eye protective nutrients are leucine, as I mentioned, from eggs and spinach. B vitamins are neuroprotective in general, and that's important because the optic nerve connects your eye to your brain for vision. So optic nerve is a good thing to protect, and B vitamins in general take care of that. Vitamin E, vitamin C, and vitamin A are very good antioxidants and supporting the structures of the eye.
That's great. So, I mean, again, if you have a balanced diet, you're going to get many of these vitamins, and then you may want to supplement beyond that. But it seems like to get all those vitamins, you would really have to be conscious of what you're eating and make sure you're getting all of your fruits and vegetables every day.
Yeah, it's particularly important to eat the multicolored vegetables, and bright berries are great.
Right. Well, tell us about your research. What are you doing to advance this cause?
So my mission in recent years has been to get the word out to nurses, both nurses in practice and nurses who do research about making people's lives better. The first study that really was a wake-up call for me came about through our Women with Disabilities project, and we interviewed women at the Philadelphia Federation for the Blind. We had 18 women who, for whom visual loss was their primary issue, but not necessarily their only issue. A number of those women were wheelchair users because perhaps the mediating disease was diabetes, and they had other complications. But we learned from these women that we heard them talk about their isolation. We heard them talk about how difficult it was to keep health appointments. If they were paratransit users, they couldn't flag down the van because they couldn't see the van. They didn't know which exit of the hospital to go stand at for the van to pick them up. Those kinds of transportation issues were huge. We learned how they are reluctant to ask friends and family for favors. So as you lose mobility, if you can't, call up Surrey Services or some other kind of facility to get where you need to go, it's very difficult to be dependent on your community. They talked about how demeaning we in the healthcare business can be for people who are not fully functional, because we assume that they know what we're talking about, that they can see where we're pointing, that they can read the literature we inevitably stick in their hands.
So that's a really important point for anyone that's watching this show who is a healthcare provider, that you really need to stop and assess your patients, especially as they are aging, and be sure that they really understand what you're trying to impart to them because of their sight issues.
Absolutely. And visual, we are not attuned to providing non-literature support to patients. Even the Diabetes Association is very poor at putting out information for people with low vision, and they, of all people, should should know. The women pointed out that AARP is very bad at putting out information in a non-literature mode. So it's interesting for us to think about other ways of getting our information out, health education information out to people.
Because the brochures are very tough for people to read. That's really basically what you found. Okay.
Right. There are machines available for people, reading machines, but as I mentioned earlier, they're expensive.
Right.
And there's software for ordinary computers.
You're also going to show us that picture of a pill bottle.
Yes.
That has an adaptive device on it.
We do know, we have many devices. We have talking pill bottles where it can read the information on the bottle that's normal and say it to the patient. It can tell the patient, you know, how many pills to take, and you can also get phone messages from your pharmacist that will remind you when to take your medication.
That's great.
Yep.
That's great. So there are some, limited as they may be, there are some adaptive processes.
There are talking glucometers. There are lots of equipment available. It's just that providers don't think to refer people to the services to help them access it, and cost is a barrier. It's not routinely covered by insurance.
Well, based on your research in our closing moments, tell us what is really the implications for the healthcare providers, and what are the implications for the consumers at large? So
overall, other studies that I've done using the National Health Information Database have shown that low vision is associated with all kinds of health complications, from diabetes and heart disease because of low mobility, lack of exercise. It's associated with falls, joint, hip injuries, all kinds of musculoskeletal problems, psycho-emotional issues, access to resources. So my research corroborates other people's research in that regard. We, who are the aging boomers, need to be proactive in doing what we can to optimize our visual health. We, who are healthcare providers, need to be attuned to the need to put prevention of eye disease high on the list of things we're looking out for. And for people who have visual disturbances, we need to see how we can accommodate our services so that they're accessible to these people.
That is wonderful. Well, I think that Dr. Sharts-Hopko has really helped us today to really prioritize our eyes. It seems like a no-brainer, so to speak, but it isn't, because of the statistics. And her research has shown that when people do have eye problems, they tend to be shy about it. They don't really want to talk about it. They don't want to depend on other people. So they slowly sink into more either depression, isolation, just not going out, not having the quality of life that is really coming with good vision. So I think that I've learned that in addition to having my yearly dental appointment, I'm going to certainly be sure that I have a yearly vision appointment. And I hope that you will do the same thing, because what we've covered today in our key points is just the incidence and prevalence of this disorder. It's much higher than we would think it would be. Secondly, we covered about how it can sneak up on you. And if you don't have these baseline exams, you could really find yourself in a deeper problem area that's harder to fix. So you really want to make sure that you're being proactive. We've learned about how diet, exercise, nutrition of all types, like really having a healthy lifestyle, also good sleep, not smoking, not being around people that smoke, is really very, very important. And I think for those of us who are healthcare providers, we really need to take a deeper dive and think about how many people there are out there with low vision or no vision. And we really need to find adaptive ways in our primary care settings and in our hospitals, nursing homes, because low vision or no vision contributes to very poor outcomes, not just for what you are in the hospital to be dealing with to begin with, but things that could happen to you: falling, tripping, not understanding the directions that people are giving you, not knowing what to do when you are discharged. So I want to thank you again, Nancy, for being our guest. I want to thank those of you who have been our listeners today. I hope that this show has really addressed something that you can take away. Thank you so much for joining us, and have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.